Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video in response to a question that somebody posted on one of my other videos about related to mold illness. And just before I jump into the question, just in case you're watching this video on YouTube, just please note I don't receive any payment for advertising that they put on my videos, nor does YouTube ask me which videos I'm okay with them putting on my video. What types of ads they put before my videos. So just FYI, no relationship there in any way, shape, or form. So the question is, and this was kind of a follow-up question to a scenario where someone was living in a home that had mold contamination. They'd moved out of the home, and then there were still some symptoms afoot with a family member. So a follow-up question was, is there any way to make sure that we are mold-free? I still have severe brain fog, anxiety, depression, and pressure in my head after being out of the moldy house. And if memory serves, I think they've been out of the moldy house for several months anyways. So as per usual, I can't give any treatment advice or medical advice over social media. Can't give advice to anyone who's not one of my patients. So please consult with your healthcare provider to get medical information and advice. But I can speak about this type of topic academically and speak to it from my personal experience working with patients in analogous scenarios. So the long and short of it is that the vast majority of patients that I work with who have mold illness, as evidenced by testing and or response to treatment for treating them for mold, they've been out of the moldy environment for quite some time, sometimes for sometimes decades. I have some patients where, as best we can tell, the original mold exposure happened when they were a child, and now they're in their 50s, for example. So patients in my practice certainly have persisting symptoms after they get out of the moldy environment. Now, to my understanding, based on some of the studies that have been done, a lot of folks, when they get out of a moldy environment, they fully recover, or as best we can tell, they fully recover, and there's no obvious health sequelae or side effects from that. However, some folks certainly do have persisting issues. So if I had a patient come to my practice, as I have many times in the past, but if, say, I had a new patient come in tomorrow and they said, hey, I was living in this moldy environment, I have certain symptoms that are, I'm thinking like, oh, that sounds like mold illness, and I was wondering if they might still have a mold-related issue. The test that I would run is doing something called the urine mycotoxin test, and I believe I've posted about this in the past, but if anyone has questions or whatnot about that, I'm happy to talk about it again if it's of interest. But basically, it's a urine test where after a little bit of preparation, avoiding certain foods, avoiding certain supplements, a patient will produce a first morning urine sample, send that off to the lab, and then it's analyzed for the presence of mycotoxins. Mycotoxins are the toxins that are produced by mold, so it could also be called mold toxins, but it sounds fancier, I suppose, to call them mycotoxins. And then depending on which mycotoxins appear in the urine, if any of them do, we semi-regularly get results back that show nothing there at all, especially if the patient's been treated successfully. Then the type of mycotoxin that's produced can be traced back to the type of mold that produces that mycotoxin. So for example, if the urine sample came back positive for something called ochratoxin A, well, we know that mold toxin is produced by the mold genus Aspergillus. It's kind of like the mold species, if you will, just technically it's the genus. And so it's made by Aspergillus. Or for example, if we saw elevated mycophenolic acid coming up in the urine, that's a mycotoxin that's produced by Penicillium species mold. So depending on which mycotoxin is in the urine, then we trace it back to giving us insight. Well, it tells us which mold type produced it. And then if the patient's been out of mold, they weren't eating a bunch of moldy food leading up to the test sample collection and whatnot, then we can assume, well, this mold must be coming from inside of you. Maybe it colonized the sinuses, maybe it colonized the lungs, but you seem to be a walking mold incubator, if you will, and it's releasing those mycotoxins and hence seeing them in the urine. So that would be the most definitive test to run. The challenge with urine mycotoxin testing is that it's quite expensive. There are a couple of different labs that offer this testing, which is good because it used to be that there weren't many options, and the options that were there were even more expensive. But in US dollars, because there aren't any Canadian labs that do this testing here in beautiful Canada, it's $329 US to do the testing. I think it's cheaper for patients, individual individuals who live in the US, because we get international pricing, which is not a good thing. Now we have to pay more, unfortunately, here in Canada, which anyways, and we pay for shipping on top of that, so I don't know why there's the international pricing, but in any event, that's what they charge the patients. So it's quite expensive. There is another test that can be done called the visual contrast sensitivity test, and that visual contrast sensitivity test is not specific to mold, but it can give some really good insight as to whether mold might be on the table. So if a patient of mine said, like, I was in a moldy environment, and I've moved out and I'm still having symptoms, then if either they couldn't afford the test or we didn't want to wait the 4 to 5 weeks to get the results back from the mycotoxin test, then we might want to do a visual contrast sensitivity test. And if they failed that test, then that would give me some good objective data to suggest, well, maybe we are dealing with a mold issue here. And so anyways, there's lots of virtues to the visual contrast sensitivity test, and if there's interest, I'd be happy to post a video about that. I might do it just for fun because I talk about it a lot in practice anyways, and why not post a video about it? So anyways, I hope that information is helpful. If there's any questions related to this topic or any other ones, please feel free to post them below, and I'll do my best to answer them when I can.